Well, hello, we want to welcome you. Today we wanted to take some time to talk about hospice. We get a lot of questions about when is the right time to choose hospice, and so today we wanted to address the topic of when hospice becomes a reality. Today I have with me Shaunna Branch. She's one of our nurse liaisons with Circle of Life here, and we just want to take some time just to discuss a few questions and maybe help to answer some of your questions that you might have. So Shaunna, can you tell me when is hospice appropriate? What is kind of the early signs that we're starting to look for?
Well, you know, there's a lot of different opportunities for hospice. There's many different diagnoses, there's many different things that can be going on with the patient, and it really depends on the individual situation. So with hospice care, maybe grandma has gotten older and you're curious, she has a little dementia, and is she beginning to decline? And in those settings, it's usually a patient's beginning to decline. You suspect that they're not going to do as well as they had been. There may be an event that's occurred in a cancer patient. Maybe there's no longer treatments options. Maybe the patient is tired of doing treatments. You have to be in a certain point in your life in order to qualify for hospice, and typically that's in the last 6 months of their life, or suspected they could be in the last 6 months of their life. But it's okay for families to reach out if they suspect there's just something not going right, and physicians as well.
Yeah. So what are some of those signs? And you kind of mentioned that.
In hospice care, we have what we call eligibility criteria, okay? Those are what I use when I go out into the community. I may go to someone's house to discuss hospice or whatever. Those are what maybe a physician calls our office and says, I've got this lady with, say liver disease, and I want you to come assess her and see if she could have hospice yet. And her liver disease may be from any number of reasons, but there are certain criteria and eligibility criteria that a patient has to meet in order to be suspected to be in that last 6-month period. So Medicare provided us with a list of specific diagnoses, but you know what, we like to think outside the box. I just this morning had a gentleman that was 101 years old, and I was trying to figure out what could be his hospice diagnosis because he was declining. But you know, it takes some thinking outside the box too sometimes to make that happen for a family if they believe this is the next most right step, and if our team believes it's the next most right step. So I mean, it could be any one of these things on this eligibility criteria list that I use, such as cardiac, pulmonary, dementia, renal disease. They could be on dialysis and decide that they just no longer want to do that. It's not the way they want to spend their time. Sure. When you're in a dialysis chair, you're in a chair 4 hours every other day usually. That's a lot of hours a week. And sometimes you don't feel well as your body begins to decline. Your body tells you when you need to kind of let go, and some people want to stop that, and that's an option. Or you may be in the hospital and have kidney injury due to the fact that you had sepsis or whatever. We see that a lot. You may be someone who just had a stroke and you're no longer able to swallow well. And maybe you decided a long time ago when you made your living will or whatever that you didn't want a feeding tube, and you know you're not going to be able to swallow anymore. You can choose hospice if that's the case, if you're not able to swallow well and maintain your nutrition, because you are going to lose that weight and your body is going to begin to decline rapidly. Sometimes we have an ALS patients. Those are awesome, wonderful people that we get as patients. And they often do not come on super early because we still have to document the decline of a patient. But the things we can offer an ALS patient, we partner with a local nonprofit, and it's so awesome to be able to do that and get these patients what they need and support for their families. Because every one of these patients, what they have in common are symptoms that are not well controlled.
So what does hospice do, and how can it really help a family and for that patient?
Hospice is pretty much a supplement to what the family's got going on. So we have an awesome team that can go out and do assessments of the family. If this patient is appropriate for hospice and we start hospice care, whether it's in the home or in one of our hospice homes, this family then becomes part of our family, and we get this team that works together with their family. They have certain members of our team that do certain things, and they still get to care for their family member in the home, but they have our support. So they have 24-hour support from our team. They can call us 24 hours a day to get help, to answer questions. There's always somebody available. It's a team so it's kind of one-stop shop, I say. There's a team effort there, and they don't have to call anybody else. They don't have to go to doctor's appointments anymore. They don't have to go out and try to get mom in and out of a wheelchair to be somewhere. They have our team that comes to them, so they have a nurse that comes out to see them, and just having that team and the support, I think the emotional support. Hospice is a mind, body, and spirit type situation, so we support them in all those areas. We have chaplains and we have social workers, and we just have an awesome team that supports them. So mostly I think it's the support and then the symptom management, and families just need someone to walk alongside them. A lot of them have never done this before, and they need somebody to walk alongside them, and that's what our team does.
Yeah, excellent, excellent. So how much does hospice cost?
That's a question I get a lot. How much is this going to cost, Mom? Well, you know, Medicare was very kind many years ago, and they put hospice in their benefits. So for the physician, the team, the medication, the equipment, everything that we supply for a family, it costs a family nothing. So typically, I like to say hospice doesn't cost anything. Now, if there's caregiving issues, sometimes family members do have to pay for some caregivers out of pocket, but hospice doesn't cost anything. Inpatient hospice is typically covered if the patient qualifies to be at the highest level of care at the inpatient unit, and there's qualifiers for each level, just like there's a big umbrella that you have to qualify for hospice under. There are several other umbrellas as to where are we going to do that hospice and how is that covered. But hospice itself doesn't cost anything.
Wow.
It's covered under most insurance benefits, and it's covered under Medicare.
That's amazing.
It is awesome.
That's awesome.
And you know, with Circle of Life, we don't ever turn anybody away. I don't go in and look to see a patient and look at their insurance first. That's not what I do. I go in to care for a family and to talk about hospice and to help them understand what benefits they can get from hospice if it's an appropriate time in their life. I never look to see what their insurance is first, which is an awesome job to have because I don't have to worry about that because we take everybody.
That's awesome. We do have a charity fund as well.
A charity fund for that.
Yeah, that's awesome.
But most of our patients are Medicare patients or private insurance.
Good. Wow. So does that mean that there will be somebody from Circle of Life in their home at all times?
Actually, it doesn't, and some people do get confused about that. What we have is the team that supports you. So you don't have someone in your home at all times. So if a patient lives alone and it's no longer safe for them to be alone, we will work with the family to help them find suggestions for where they can go to live, like long-term care, assisted living, things like that. Or we have lists and partners in the community that do in-home care. The nurse is there about an hour, kind of like a home health situation, a few times a week. 3 or 4, whatever it needs to be, 1 or 2, depends on the patient's illness and how sick that they are and what they qualify for. And there's, of course, a nurse's aide that'll go out and bathe them and that kind of thing. But the family is the caregiver, and that's always the way that it is.
Okay, excellent. Well, good. So how do we have 2 beautiful hospice homes? How do you get the care to stay at one of the hospice homes?
Oh gosh, I love our hospice homes so much. Everybody wants to come to our hospice homes. Basically, most of the patients that come into one of our hospice homes, we have 2 beautiful 24-bed hospice homes, one in Bentonville and one in Springdale. And to come into one of those hospice homes, you have to qualify with symptom need. In other words, say you're a patient that's at home and you are having trouble with pain. Say you're a cancer patient with bone pain because you've got metastasis to the bone and you're having struggles taking oral medicine and the pain is not well managed. Well, that would be an opportunity for you to come into our hospice home, and Medicare or your private insurance would then cover that at 100%, and we would find some different ways to manage your pain and then get you back home. Or if you're a COPD patient or a lung cancer patient or whatever it is, if you're very short of breath and anxious because of that, sometimes we come into the hospice house to do some management of those symptoms a little bit better, and then you can go back home. If patients want to be in their homes, we want them to be in their homes, and we will do everything we can to make sure that they're well supported to do that. So if you're in the hospital, for instance, and you're not doing well, and we know that you're in the very last phase of your life, and you are no longer able to eat and drink and swallow your medications for comfort, that's an appropriate time to come into the hospice home, and your insurance will cover that as well. So most of the patients that come to the hospice home are for short stays, 5 to 7 days, for either end-of-life care or symptom management. But you have to have a reason to be there for your insurance to cover it.
Okay.
It's not a long-term care setting. It's not meant to be for long-term care. We're not licensed in the state of Arkansas to do long-term care, so it's not a nursing home. It's a hospice home for end-of-life TLC and care and symptom management and that kind of thing.
Great. And then we also have respite care.
We do. So if a patient is on hospice and they are in their home, most insurances will cover 5 days worth of respite care. So if you're already on hospice, then it's possible, if there's a bed available in one of our hospice homes, that you could work with your social worker and your nurse and the physician, the hospice physician that's over your care to get a hospice stay in the inpatient unit to give the family some rest if it becomes exhausting being a caregiver, because that is a lot. Sure. It's a lot for someone to take on.
Absolutely.
So that's there as well.
Great. So tell me, why should somebody choose hospice early? I know a lot of people talk about, well, it has to be just those last final hours or something, and then we call in hospice. There's a lot of fear about that, but what are some of those advantages of really getting that team in early?
That's one of my favorite things to do, is get a patient on hospice early. Excuse me. It really allows the family and the patient to utilize all of our team elements. So you get the care early, so you start early, you have more time to spend with our team, and our team has more time to get to know you and help you do the things that you want to do. Because in hospice, we don't give up on you. We say, we're going to focus on what's the next most right thing is. We're going to focus on hope for good days. So we don't give up hope. We have hope for good quality days and quality of life. Yeah, we're going to let go of some days that we might have gotten if we didn't choose hospice, and maybe we wouldn't have gotten those days even if we did choose hospice. It doesn't matter. But we want to focus on the next quality of life. So if you come on early, then you have the ability to utilize our social work team, our chaplaincy team, and there's other parts of our team I think we're going to discuss a little bit too that really can be utilized. And you have better symptom management. You can enjoy your children. You can enjoy your family better. And it becomes a situation where it's not all about getting mama to the next doctor's visit. It's about enjoying mama and spending time with mama and being the daughter or the son or the husband or the wife more than just being a caregiver, because we can give you the support that you need.
Excellent, excellent. And we have time to do some of those end-of-life wishes.
Exactly.
Oh, we've had some special things that we've had opportunities to do when we've gotten some of our patients a little bit early.
Right.
We get to know them. We've done, so many different fun things. It could be maybe just a special meal. They hadn't had maybe lobster for a while, and that was something that they really wanted, bacon every day. But also we've done birthday parties. We've done horses.
We've done weddings.
We've done weddings.
I got to take someone down the aisle in this very chapel that we're sitting in.
That's right. That's right.
It was awesome.
Yeah.
So yeah, we get to do a lot of really cool things.
So many special things of advantages of really choosing the
well,
hospice
and a living legacy is such an awesome thing to leave for a family member, especially if you're a younger, say, mom or dad that's got cancer. I mean, what an awesome thing to let our team help you do.
Exactly.
Put some or a grandparent that wants to leave something for a grandchild. It's just a really awesome thing that we can do. In hospice, I like to think of us as the specialists of this area. If you had a cardiology problem, you'd go to a cardiologist. When you need end-of-life care because your body's beginning to fail for whatever reason, we are the specialist in that. And why would you not want to choose hospice early to take advantage of all of that? So I really believe in what I do. I love what I do. It's a privilege and an honor to get to do what I do. To sit down with families and be at that very special time in their life. Oh my gosh, this is the best job I've ever had. And I've been a nurse for 38 years. This is my best job ever. So to get to spend that quality time with families and explain what we do is really awesome. And to be able to offer this to our community and to be able to have these two awesome, beautiful hospice homes that we can offer our community, it's really awesome.
Yeah. Well, good. I completely agree. This is an amazing place, and we want to really urge everybody to ask questions and give us a call. Our phone number is 479-750-6632. Call us, and we are happy to answer any questions. We'll walk with your family and really make the assessment and really help you guys to make good decisions for your future. You can visit our website as well. There's additional information there on www.inhome.org. nwacircleoflife.com. And we look forward to visiting with you soon.